Hi, it's Kristen here at UT Southwestern Medical Center. Thank you so much for tuning in today when we talk to Dr. Jim Gilmore about facial rejuvenation. So Dr. Gilmore specializes in facial plastic surgery with a concentration on facial rejuvenation procedures. So before we get started, as usual, don't forget to like and share our conversation. We want this to spread as far as we can. And also what you want to do is write your comments in the comments field below the live stream. So we will take as many as we can get to, and I'm really glad you're all here tuning in today. So Dr. Gilmore, thank you for joining us.
Thank you for inviting me.
Absolutely. We already have some questions that have started coming in, and so I thought we would actually start with those. And one of them, her name is May. It's May Mendoza. Hope she's tuning in now. And she says, with sagging skin, aside from a facelift, what are some other alternatives to treating sagging skin? Apparently she can't deal with general anesthesia and had malignant hypothermia.
Okay, you can do, it depends on the level of improvement the patient wants.
Mm-hmm.
You can do different kinds of fillers.
Mm-hmm.
There are little minimally invasive procedures that can be done, and certainly we don't have to use general anesthesia. We can circumvent the problem with malignant hyperthermia by using what we call MAC anesthesia.
Okay. And what does that entail?
Well, it's use of intravenous drugs and not general inhalant gases. And it would actually provide the safety net for her history of malignant hyperthermia.
Okay, interesting. So that great question, May. So I guess just before we get further into these questions, could you tell us a little bit about, what does facial rejuvenation entail? What are the goals for it?
I think the main goals are for the patient to receive the results that they envision,
Mm-hmm.
and we envision that to be minimally invasive and natural,
Okay.
and non-artifactual.
Gotcha. All right. So is there anything in this question? We've got one from Debbie. So Debbie Taylor said, if you have nerve damage from a tumor, is there anything that can be done for one side facial weakness?
Yes, this gets a little bit into the reconstructive aspects, which we do. If the nerve is totally out, there are techniques for nerve regeneration techniques and free flap muscle implantation techniques. But if there's only partial weakness, we can do different kinds of muscle slings and facelifts, and actually facial implants to revolumize the side of the face that's very weak.
Gotcha. And we talked about that a little ago before we started, that you do a fair number of facial implants and that you can do them minimally invasive. Is that right?
That is correct.
So what are the common facial rejuvenation procedures that you see?
Well, actually, when you starting at a younger age, we look at doing tightening up around the eyes when there's loose skin, maybe like the drooping of the brow, or filling the lips when they're slightly sagging. And then as we move further, we can actually, as we age, unfortunately, we lose volume and fat in the face. And by using facial implants, which can be done under the lip or under the chin through tiny incisions, placed against the patient's bone, we can use an implant that will actually permanently give the patient what we call infrastructure remodeling.
Okay.
Which we call an internal facelift.
Okay, an internal facelift. So an internal as opposed to an external, kind of more visible facelift?
So in the aging process, the main problem is our face loses the mid-face volume, so the triangle changes from the youthful triangle to a more aging triangle.
Okay.
So by restoring that, we can rejuvenate the aging face into the youthful face.
Wow, interesting. So at what age, and this was a question that came in beforehand, at what age should people start thinking about facial rejuvenation, or when do you see most of your patients start coming in?
Well, actually, most people should be cognizant of the things that can cause aging, such as the sun exposure, smoking, bad habits like that. Some dermatologists recommend using things like Retin-A even from an early age. The main issue is like avoidance of sun. But when one decides on doing different procedures, it could be if they had really an ugly nose, they might want to have that done when they're like in their late teens or 20s.
Okay.
if they want to have some things done that would enhance their careers, say they're in modeling or in the movies, could be in their 30s. Most people are going to start doing things in their 40s and 50s.
Mm-hmm. Okay. It's a good, well, this is a really good time to remind people that, be sure to submit your questions in the comments field. We are here to answer as many as you can. We've got a bunch of questions already coming in. If you are having audio issues, it's a good idea to try refreshing your browser. Usually that'll take care of it. But all right, so we're gonna take another one. So this one, this is a good one. I think a lot of people ask, how long is it recommended to do facial rejuvenation after a burn? Is that an option?
Well, no, there is an option. First of all, we have to make sure, if we're talking about a thermal burn, we have to make sure the wound is healed. We've done all the optimal treatments that can optimize perfect, what we call scar camouflage.
Okay.
But once it's actually healed, and by the way, today we use lasers sometimes actually to enhance and to reduce the scarring from a burn. And once that has been determined, then they could be on the same pathway as any other patient who didn't have a burn.
Mm-hmm. So another, related to that, so I think this is similar, this is from Julie. Julie says, what if you have fair skin? Are there special considerations for rejuvenation?
Not at all. Actually, fair skin, we have a classification which is called Fitzpatrick, named after Dr. Fitzpatrick, that classifies skin according to their coloration, like from 1 to 6.
Okay.
And also from the ability of that type of skin to resist sunburn. But the more fair skin is actually, there's a little bit of faster aging, but they're actually almost better candidates for certain types of facial rejuvenation. So skin type in itself is not a deterrent to doing facial procedures.
Interesting. All right. So we've got another question here, and I think you've addressed this in the past a little bit. They are saying, what is the difference between a plastic surgeon who does facial rejuvenation and an otolaryngologist like yourself who does facial rejuvenation and plastic surgery?
Well, that's a very good question. First of all, in otolaryngology is a long residency involved the surgery in the science of head and neck. And about 25% of our residency training is devoted to plastic surgery. So for myself, I'm board certified in head and neck surgery, otolaryngology, and facial cosmetic surgery by the American Board of Cosmetic Surgery and by the American Board of Facial Plastic Surgery. So facial plastic and cosmetic. So it depends on their training, whether or not they're a plastic surgeon, an otolaryngologist, and facial plastic surgeon, and how much time do they devote to a given area.
Okay, that makes sense. So we've got a couple more questions coming in, and Debbie asked, is this live feed saved for later viewing? Yes, it'll absolutely be saved, and you'll be able to watch it later. I hear you missed the first one. So here's a question from Norma. So Norma says, what can you do to help with deep scars from shingles?
Okay.
That seems pretty common in some groups.
Okay, so you would have to see each patient and make a decision, but when one has depressed scars, whether they're from acne, shingles, or any other types of scars, we need to work toward trying to elevate those scars. So you can do sometimes injectable fillers, sometimes tiny microsurgery to elevate the scars. And then some of these patients may benefit from either what we call dermabrasion or laser abrasion. And they can be evened out. In some deeper scars, we actually take fat injections and actually fill them up from below.
Oh, wow.
So the whole idea is to get the depressed scars more elevated so they're not so noticeable.
And is that something that you could do as an outpatient procedure that people come in?
You can. Most of the acne scar treatments could be done under minimal or local anesthesia. Sometimes the laser treatment may require more of an anesthesia because it is uncomfortable.
Okay. Now we touched on light skin earlier. One of the questions that Crystal was wondering, she says, what if you have darker skin? Are there special considerations for darker skin?
Well, interestingly enough, the darker skin doesn't seem to have the aging features, and they're very good candidates for cosmetic surgery. They're always the concern for darker skin to help with keloid formation, but realistically, we don't usually see that manifest in the face.
Okay.
So there really is no contraindication. And even today, one can use laser technology, that we have more modern advanced technology in darker skin types that we couldn't use a few years ago.
Okay, so I know we want to talk about technology in a little bit later. One of the other questions that came in related to injectable lip fillers, which you talked about. They said, are there alternatives to injectable lip fillers?
Yes. So in all cosmetic procedures, there are various levels of enhancement. First of all, there are procedures, you can do procedures such as use one's own body fat. You can do procedures called threading, where we put biodegradable threads in with no actual visible scars. And then there are more permanent implants that we can use if the patient wants a more permanent result. Tiny strips of material such as EPTFE, which is known as Gore-Tex.
Really? You can use Gore-Tex?
Well, not in Gore-Tex. It's the same material that we would use in using garments that would be made out of Gore-Tex. But this is EPTFE is used for implants and vascular surgery all over the body.
Wow, I didn't realize that. That's fascinating. All right, so we've got a couple questions here, and I'm not sure if you can answer these. And if you can't, just say so. But one question is wondering, will Medicare help pay for a procedure for shingles? Is that something to maybe talk to?
It's hard to tell, but if it's a medical problem, and that sounds like it could be, then Medicare would pay for it.
Okay.
Unfortunately, Medicare, there's no predetermination. We can't really determine before if they're going to pay for it.
Right.
But we can get an idea. But if it's a medical condition or scar, they should pay for it.
Okay. What about cosmetic procedures? Does Medicare or does insurance usually pay for cosmetics, or is that?
Usually insurance, there are some instances where we do reconstructive surgery, which could be considered cosmetic, that insurance will pay for. It's normally, most cosmetic procedures are private paid.
Okay. All right, so somebody was asking here, and I missed the name. I apologize for that, but they were wondering if there were things that they can do at home to keep their skin looking young.
Well, I think we touched on a moment ago of sun avoidance, no smoke, normal skin care. Certainly, people advocate the use of Retin-A early on. Most of the dermatologists feel that it does have a known positive scientific benefit to the skin by thickening certain layers that prevent the wrinkle formation. So sun avoidance, using sunblocks, possibly Retin-A, good skin care, good nutrition, hydration.
Okay.
Yes, those things.
Gotcha. So to take care of your skin, you want to make sure no smoking, good nutrition, lots of water, possibly Retin-A, avoid the sun.
That is correct. There's some evidence that maybe certain products such as topical vitamin C could be also helpful, but there's a myriad of products out there, but most of them have a quasi-scientific basis.
Okay, that makes sense. All right, so we got some more questions coming in here. So that eyebrow waxing. So they're wondering, does eyebrow waxing cause wrinkling or sagging around the eyes?
No, I don't think that should. However, it can diminish and damage the hair roots, and over a period of time, one may end up with diminished hair population of the eyebrow, which I think most people don't want. So we have to be careful with that, because you can, with waxing, get little punctate, tiny scarring around the mouth and the eyebrows. So you have to be careful with it.
Okay, that's a really good question, Lori. So one of the things people talk about a lot is Botox. Is Botox considered a facial rejuvenation procedure, or is it different?
Well, no, I think it would be it's an adjunctive procedure that can be, I consider rejuvenation into entry level or mid-level or high level. It's more of an entry level.
Okay.
So if Botox can actually help to get rid of anger lines and wrinkles around the face and eyes. So yes, it is positive.
Okay, so we had another question that came in before the chat. They were wondering, and this is something I see a lot sometimes in the news, maybe it's a bad facial rejuvenation, but they're wondering, will I have a stretched look after a facial rejuvenation procedure?
Well, I think some facial rejuvenations that I see do look, well, I call artifactual. I think that's what they're trying to say, stretched.
Yeah, probably.
But that is not our goal. Our goal is actually have a natural, youthful look. So the patient will maintain their age at present for a longer period of time.
Okay, so the goal, and from what I read from your profile, you're really looking to meet the goals of the patient, correct?
That is correct. I think it's important that we talk to the patient, find out what their goals are. Realistically, we can come to some consensus about what can be done and prioritize those procedures. So once we've come to that consensus, then our goal is to have an artful, a natural rejuvenation process that's minimally invasive.
Okay. Yeah, we're gonna talk about technology in a minute. But we had a question come in from Larry. So Larry says apparently he has a shingle scar on his forehead and is wondering if there's anything available to correct the scarring. And we talked about this a little bit. Maybe we could readdress it.
Well, the first, there's various techniques. Some of the injectable fillers can be used to actually lift up the scar to fill the deficit. Usually the scar is noticeable because it is what we call depressed. It catches the light. You can also do fat injections. You could do laser or dermabrasion. And in some cases, you can actually do a scar revision.
Oh, wow.
As long as we place the scar in an area that we can hide it in the facial lines.
Okay. So we've got another one from Valerie. This is a new one. She says, what is the best type of permanent facial hair removal? Is that something that we do here? Maybe not.
We do it in the Department of Dermatology, yes.
Okay.
Yes.
Okay.
So we have everything at UT Southwestern that the patients want. So
there you go. All right. So maybe that one would be better to go.
So there are, yes, there's no true permanent hair removal. However, there's two categories of, one is called intense pulse light, and the other is different kinds of laser technology.
Okay.
So those can actually diminish the hair growth for a long period of time before it may ultimately come back. So it's, I would say, suppression of hair growth as opposed to hair removal.
Okay, good point there. Good question, Valerie. So we've got a couple here from Joe. We're going to take the first one. So Joe Smock, he says, if you get a non-surgical nose job using a filler, what does it mean that your nose is swollen for a whole week? Is that a side effect? Is that what's supposed to happen?
The non-surgical, everybody is looking for something minimally invasive and simple and cheap. But we have to be careful when we make a decision that we get a procedure that's definitive, authentic, and gives the final result that the patient is pleased with. The non-injectable fillers is a popular technology that we see around. So probably after a week, that doesn't mean much because the filler may have been overcorrected a little bit, but over time it should actually resolve. However, if it's red or inflamed or tender, he should see his physician.
Okay, that's a good one. And he had a follow-up question for that. And this may be applicable to all scars, but Joe was wondering, what is your treatment for ice pick scars? It seems like that single...
So there are several techniques, but that's a very good question. The ice pick scars are noticeable because they're a deep, depressed scar where the skin is growing down into the wound. So the main treatment is actually to do a tiny excision, which we call a punch graft, and actually punch out all those ice pick wounds. We can actually close them up delicately or leave them and let them close on their own. And then, as a corollary to that, to come back and do some type of laser resurfacing or dermabrasion to even out the scars.
Wow. So what I think this is one of those treatments we were talking about earlier, but this came in a minute ago. Crystal was wondering, what is Ulthera? And excuse me if I didn't pronounce that correctly. Is that something that's an option?
I don't know what it is. I have to explain it to me. Maybe she can explain it to.
We'll have to see. So it's Ulthera, Ulthera.
Oh,
Ultra. Thank you. I mispronounced it.
Okay. So Ultra, it's a type of injectable filler, and there are many different companies that make different ones. Ultra is one brand, and so actually it's a hyaluronic acid filler. This is the most common type of filler used today, and Juvederm Ultra, maybe that's the one they're trying to mention.
Okay.
So there are different levels of the Juvederm, and there's Voluma.
So it's one of the fillers.
So it's one of the fillers, and there are many different names, but there really are just a few actual chemical fillers available, and that's one of them. So hyaluronic acid is the name of that filler.
Okay, that's a good question. I apologize for mispronouncing it. All right, we got another one. Joe came back with one more question. He says, what are your thoughts on microneedling and aftercare instructions? He says, I want to use vitamin C for after treatment. Is that
I think, microneedling is something that's been around in the physical therapy world for a long time. It's also now have found its way in the facial world. A lot of the facialists and dermatologists use it. So I think it's probably okay.
What about vitamin C?
The vitamin C has less of a scientific profile about its effectiveness, but it is one you could consider. It seems that retin A has a lot of scientific evidence, and vitamin C has more marginal evidence that it can help.
Okay. All right. No, early on before we chat, and questions are still coming in. Wait for this one about technology. That there's a lot of new technologies available for facial rejuvenation and other procedures. What is kind of the new thing?
Well, we could even use robotic surgery to do facelifts, but this is pretty much an overreach for technology, where robotic surgery works beautifully in many other areas of our surgical science. But endoscopic surgery allows us to do, for instance, forehead lifts through tiny incisions, which are like a 1/4 inch plus through the hairline, and there's no visible scars, and we can do forehead lifts. We can also do other things via those portals. So that endoscopic technique, where we use a television camera and an endoscope, we can actually manipulate and see all the anatomy, protect the nerves, protect the vessels. And the recovery time is much more, I would say, rapid following these procedures.
That's what I was wondering. What is the average, if you do it endoscopically versus maybe the traditional way, how do the recovery times compare?
Well, for instance, in the forehead area, if we do the lift, the patient could wash their hair the next day, and there's no hair shave, there's no nerves damaged, and they have minimal bruising and minimal pain. So it's dramatically improved over a technique where we used to make incisions from ear to ear, where the patients had permanent nerve damage and a wide range of hair loss. And this is a great leap forward, actually, in technology.
That's what it sounds like. You know, a tiny incision that you can't see compared to a scar that crosses your head. Okay, that's pretty dramatic, Dr. Gilmore. So we've got about 5 minutes left before our chat ends. So get those last minute questions in. In the meantime, you know, what are there things that people can do for laugh lines? You know, sometimes our laugh lines get very pronounced. Are there things that we can do to maybe minimize those?
Well, I think we're always worried about prevention. It's really difficult to prevent, other than the things we've already covered: your lifestyle, sun exposure, smoking. Many things are genetically predetermined that we can't change. But we can do fillers, Botox, fat injections. We can do a lot of minimally invasive procedures to fill those lines. And later we could do laser procedures, chemical peels, so forth.
A little bit more. Okay. So related to that, it's somebody, let's see, what is your advice for, this is a question from, let's see, from Joe. It said, what are your advice for someone in their 20s to take care of their skin, to delay wrinkles, particularly if somebody has oily skin, and maybe I'm not quite sure what that would add to it, but somebody in their late 20s looking to prevent wrinkles?
Well, I think, again, it goes back to, avoid smoking, avoid drugs, avoid alcohol, good lifestyle, hydration.
Right.
And always use a sunblock every day when you get up. And most men don't usually think of that. Women do. Women are more involved in their skincare. Men are less involved. But men need to think of it just as women do every day. Put themselves together, use the sunblock. So they will actually minimize their wrinkles over time.
Okay. I'm glad you repeated that, because when you said men are more or less involved, at first I thought you said less evolved, and I said, well, that's we don't want to go there.
My wife said that they're less evolved as well.
So that's a question actually that somebody had asked. They said, do men get facial rejuvenation?
Yes, always. We always seem to talk about women, but 40% of our patients today are male.
And are there any special considerations that men should take into account?
No, I think there's really no difference in male and female. There's difference in male and female.
Right.
I'm aware of that. But I think women are much more like attuned to the concepts and understand it. And men probably need a little more education about what their options are. And we spend a little more time, I think, counseling men than women.
Okay, so they have similar options.
Their options are the same. Their desires are the same. They probably come with less information.
Okay, good to know. So we got time for 2 more questions. One of these we just came in from Debbie Taylor. She says, what is the best way to get rid of milia? M-I-L-I-A.
Okay, so milia, that's something probably the dermatologists can handle really well. Because they're like little plug pores, but sometimes they use different techniques like light chemical peels sometimes can work for those, or maybe just some skincare option. But then some patients may require like laser resurfacing. But I would think if you check with a dermatologist who does cosmetic procedures, they would be more than appropriate.
Okay, all right, good question. So we're going to get slightly, for our last question, we're wondering, and this came through in a couple different ways. So all these different treatments we're talking about, whether they're procedures or it's inpatient, outpatient, are they permanent, or are they things that people need to repeat and come in repeatedly for?
So if we do a correction on the nose where there's a big hump, we take it out, it's permanent. If their ears are prominent and we bring them back in more of a natural look, that's permanent. When we do facial implants, which is why I like to do internal facelifting or facial rejuvenation, which we call minimally invasive, that's permanent. Other procedures, over time, the results will diminish, but I always tell the patients that the results that they have will always be with them. So they will always look younger than they would generally if they had not had the procedures.
Okay, so long term they will...
So they may want to have some additional like touch-up procedures. Sometimes they'll have a facelift and a neck lift, and a few years later maybe their neck needs a little tweaking. So maybe it's not going to be as much as they had before. So it can be effective that way. Gotcha.
So if they want to, if they want to still have a natural look, that is something that they may need to have a little bit of a tweak done.
So you can continue the process over and over again without large scars, hiding the scars, without actually producing an unnatural look. So we should be able to do it over and over again if we needed to.
Awesome. So I think we've got another fan here. So Lori says, I remember ladies from Austin driving to Dallas in the 1970s and 80s to see you. So that...
Well, I appreciate that very much, Lori.
Thank you for sharing, Lori. So yeah, so that brings us, we are right at 30 minutes. So I think we need to call it a day. I want to thank everybody for tuning in and for all the great questions, especially for Dr. Gilmore for taking the time to chat with us today.
Thank you for inviting me, and thanks for all the people who called in and logged in.
Yeah, we had a really great turnout. So thank you and have a great day.